My name is Fred. I had the procedure of implants and crowns done here with Dr. Shoemaker. Well, I'd come to the point where I didn't have enough molars to do a very good job of chewing, especially if it was meat or anything that was fairly substantial. I couldn't chew it. So it was getting to be very drastic that I have a better set of teeth. So I began to look around and try to decide how I wanted to accomplish that. I just didn't have the teeth there, so there wasn't a lot of pain involved. I'd already gone through losing some teeth, and so I had some gaps in there, and it wasn't really pain. It was just the fact that I couldn't chew the food. So the gums don't do a very good job of chewing.
Now we fixed Fred very differently than typical. Fred needed teeth to eat with. You can't eat with just 6 teeth and have them 4 on the bottom. We made Fred a partial on the bottom. And I said, Fred, if you like this, stay with it. If the partial fits well, then you're finished. But if you don't like it, you can always come back. We haven't really wasted any time. We gave Fred implants in the back. He had a lot of teeth that were infected that we had to get out first and get things cleaned up. And so for Fred, we did major reconstruction on top, fixed teeth on top, a little more traditional dentistry on the bottom. When I talk to him and I say, how's the partial working? He goes, great. I can eat anything I want. Again, we have to go back to, can we solve the patient's problems?
He gave me a pretty broad-based approach to how he thought he could fix my situation. And then we decided to kind of work through those. And I didn't decide to do everything. I didn't put every tooth back, but I took his recommendation on what he thought would work best for me.
With him, we solved his problems. He couldn't eat. Now he can eat. He wasn't highly critical about aesthetics or having a perfect looking set of teeth or gorgeous pearly white teeth. He just wants to function in public well. We solved the problem. We solved it with a partial on the bottom. A little unusual, but sometimes the unusual works.
Since we finished the procedure, confidence is great, smile has returned. But it's very important to me that I'm quite capable of eating anything I want to eat.